I was muted, but I shared that I just got a response from Dan, and he said that he's wrapping up the meeting now, and then he can jump on. So Dan's coming.
Oh, good.
Great. Well, with that, shall we start with some of the meeting formalities, and hopefully Dan will join us when we get ready to get to the HAP item. All right. We'll go ahead and call this meeting to order at 11:07. Thank you everyone for being here. Do we need to do introductions, or does everybody know everybody?
Yeah.
Everybody knows everybody, or yes to introductions?
I think everybody knows everybody.
All right, great. Is there any public comment on non-agendized items? All right, seeing none, we'll move on. Veronica, is there anybody attending on Zoom that's not in our frame here by phone or anything?
No.
Okay, all right. I know sometimes at our council meetings, there's people that we can't see on the screen. The next item is review and approval of the meeting minutes, but they were not actually attached to the packet. So we're going to defer that item to the next regular meeting. We'll have 2 sets of meetings or minutes at that meeting then. And Dan is not here yet, but would it be appropriate, Veronica and Megan, to discuss the other HAP related items in the packet and get started with the discussion? Veronica's saying yes. Okay, who's leading this? Veronica, is it you?
I can lead it. I'll start it out. And really this is so the first item really is to discuss the budget and how we're going to allocate funds. And so I don't think we're quite ready to dive in there. So I wanted to just maybe look at item number 4, which is recommendation to issue a new RFP or RFQ for HAP. And so once we have our budget finalized today, any of the activities that are not emergency shelter, the question on the table is, do we want to just use the existing RFQ responses that we have for all other activities as well? Or do we want to issue a new one after the emergency shelter has been completed? So that's the question before the committee. Is how
just to add to it a little bit, the way the county processes work, and we have to follow some sort of process with this, is when we do a request for proposals or a request for qualifications, they're similar sort of situations. The responses are good for 3 years. So we issued one, Veronica, in 2019 maybe? No, it had to be 2020. 2020. Yeah. So we can fund organizations on based on their responses to the existing kind of the active RFQ, but we're getting near the end of the 3rd year. The problem is that the way organizations described themselves in 2020 and sort of described their capacity, for some, it's changed somewhat significantly. So we're looking at what an organization described as their ability and capacity back in 2020 and would be making funding choices based on that description from 2020. And I'm not super confident in all of them. You know, the county's changed a lot. A lot of things have changed since 2020, particularly with some of our community-based organizations. So we also, there are providers. City of Fort Bragg seems to want to do some emergency shelter work. They didn't respond to the RFQ. It's been frustrating to me because they really need to kind of get on that cycle with us rather than do special exceptions. So there could be new providers that would like to provide homeless services, and a new RFQ would offer them the opportunity to kind of formally participate in the process.
Megan, could you describe the timeline associated with issuing a new RFP at this point?
So So it should take, God, I don't even know how to answer this, Veronica. I think if we began now, we could have active responses by the fiscal year for sure. But probably let's just not say before that. So like July 1.
And we may find it easier to do multiple RFPs, one for each project type.
Right.
You know, like emergency, we wouldn't do emergency shelter, but landlord incentives and, you know, permanent housing retention support, things like that, that we can just, we will be discussing today. We can do individual RFPs to kind of, because those go faster than an RFQ.
And is the existing RFP or RFQ kind of all encompassing? Would it?
Yes.
The
So
existing
any
one
of
was
the
pretty
eligible
broad.
activities would
Yeah.
be, okay.
Yes.
You know, the existing one was really broad. It served our purposes at the time. We needed to, you know, have a process for ESG funding. There was a lot of money to get out quickly, so it made sense at the time. What we've learned since, particularly because the reporting and the way the state wants things organized and the way we want things organized, it's not the best strategy right now. Now we need to be a little bit more focused and intentional and not kind of like, tell us what you can do. We need to be a little bit more tight in order to report appropriately and have contracts that are not confusing for our contractors as well.
Can you tell me the time frame of these fundings in terms of their length of time and use, you know, at the beginning?
Yeah. So the HAP funding, homeless, whatever HAP, I don't remember what it stands for, is the state's current way of getting funding out. They began starting to issue that funding in 2020, I think. So again, beginning of the pandemic. So we are now have 4 rounds of this funding that have come to the county, and the COC has not actually allocated any of it yet. There's some dynamics to the way the first rounds happened that are, I'm going to leave aside for right now. But the county also has a portion of HAP fundings for round and 2, and then everything merges together in a big collaborative fund space for HAPs round 3 and 4. Veronica has just submitted the application for round 4. That dollar amount has not been allocated to us yet. But all of these, Judy, have timelines of about 5-year spending timeline. But 2020, we're 3 years in already. And so by June, the county has to have obligated all of their portion. We're not talking about the counties today, but the COC has to obligate 50% of their portion. Obligate, not spend. So what would happen is we were, you know, there's this kind of logical rolling time frame in 2020, but we've now just sort of put it all aside for 3 years because of the pandemic and because we had this ESG funding. So we're a little bit behind the game. But the short answer, Judy, is that there is funding available probably through 2027 in this like complicated rolling. There's 6 different grants now that Veronica has to manage. So it's a lot.
So unless we want to discuss the RFP idea further, Dan is here now, so we could go back to the heart of the conversation and kind of think about the RFP while we're doing it and maybe revisit at the end.
Veronica's right. We don't actually need a decision on the RFQ today.
No.
Just wanted you to have that in your back of your minds.
So who's facilitating? Is it still Shannon or is Dan going to take over?
It's Shannon because I'm slightly distracted. So
Okay, thank you. Okay, so are we ready, Shannon, to move back to number 4?
Yes, ma'am.
Okay, let's do that. So I'm going to share my screen. I'm going to share that. So this is a spreadsheet of each eligible activity under HAP. And if you have questions about which does what, I do have the eligible uses on a tab here. I did send this to everyone, so you do have this in your email. So we can reference that when we have questions. But here are the different activities. And this is the total funding between rounds 1 and 2 of the COC's awards. And so this is a combined total. I want to just peek at the counties because I want to show you guys something. So this is the county's HAP funding plans. This is what has been allocated so far. And so we've, the county has contracted out about 56,000 under rapid rehousing for some of our emergency housing assistance. We also have some street outreach contracts at 103,000 and some change. And so the county is willing to continue and expand funding into these categories, which I've labeled in purple. So the proposition that Megan and I have for the committee is, what do you guys think about the county funding the purple labeled categories and the COC funding the blue labeled categories, which includes emergency shelter? Please note that the COC's applications, their awards are larger than the county's.
Just to jump in, Veronica, I
Uh-huh.
might be useful for your quorum, so
You're not useful?
I might not be, because we would possibly apply for the operating subsidies and permanent housing stuff if the committee were to submit there.
Okay.
Well, yeah.
But for the sake of today, talking about emergency shelter, already
Yeah.
have applied. You haven't applied to operate emergency shelter, right? I mean, if you might have.
Well, we don't do shelters. I'm just saying if the conversation dives into operating subsidies and permanent housing, then I couldn't be involved.
So
Well,
we're
no.
talking about the overall, like how do we want to allocate the full amount? And then we can look into shelter, like the shelter requests.
The shelter question.
Yeah.
So, Veronica, why don't you click back to the COCs tab just so that we can kind of have.
Yep.
Did people follow that kind of concept of what we were trying to like play with here?
Can I ask a question, semi-related? The admin funds,
Mhm.
the table seems to imply that those dollars have already been spent. Is that accurate?
They've been allocated for administrative use to process it. It's paying for my time.
But not entirely spent yet?
No,
Probably, yeah.
this
Okay.
is the full award at
Got it.
$1.3 million.
Got
So this is what do we want our budget to be for each category?
Got it.
Totaling
Okay.
100%. So there's 93% of the award still on the table.
So on the bottom right of the
Mhm.
table where it says dollars spent, dollars awarded, is that where you're going to fill in the actual amounts that have been spent, awarded, and remaining?
Yeah, you know what? Awarded is a little bit misleading
Yeah.
there. Awarded means awarded by the state. We haven't
Yes.
awarded it anywhere.
Got it. Okay. Thank you very much.
Yeah, it's available, really.
Thank you.
How about that? Are those
Yeah.
better labels?
I think so.
It was just a fast thing I put together yesterday.
No, I appreciate that. Thank you.
Yeah.
So the nutshell question is there's $1.3 million in COC controlled HAP rounds 1 and 2 that you actually have to allocate at least 50% of it, allocate, not spend, by June. And the proposal that Veronica and I were suggesting, and the projects that are right now most in need of funding are emergency shelters. So people are working through their ESG contracts. They typically have enough money in rapid rehousing. They typically are pretty underspent in outreach. So these other categories are, for our existing providers right now, are not, I mean, Veronica, correct me if I'm wrong here, they've still got money in their contract, in some cases quite a bit in those different categories.
Correct.
So the places where people are running out of money is in the emergency shelter arena. Sage.
I will add to that RCS, if we continue operating at what we have been for the last year for rapid rehousing under the CV contract, we're going to exhaust the funds pretty quick, like pretty soon.
Okay.
Just as, which we're accounting for, like I'm working on a plan for that. I don't feel nearly as much crisis around that as I do
Okay.
around shelter. But just want to throw it out there that like, if we are talking about rapid rehousing funds, there is definitely,
It's on the horizon.
Yeah.
Okay.
Right. And I'll add to
Oh,
that too,
I had a
that
question.
McCavan is in the same situation for non-congregate emergency shelter funds. It's nearly depleted, as is the rapid rehousing.
Right. So within the shelter is non-congregate shelter, that blue line number 5. But that's an important conversation we're going to need to have today that we're going to have with a small number of people, unfortunately.
Yeah. I have a question. So the HAP rounds, what's the expenditure period for HAP 1 and HAP 2?
HAP 1 has to be fully spent by, so it goes 19, 20, 2021, 21, 22, 22, 20. I think it's
I think you're right.
2023.
No,
No,
2025.
24. 25, is it? Okay, 2025.
21, 22.
December of 25?
You might be
June
right. It
30th.
could be 24. But Sage, we were not expecting that our HAP round 1 money would extend beyond 2024.
Wait, I have this answer right here in this spreadsheet.
25. You got it right
Yeah.
there.
Yep.
6/30, 25. Okay.
Mhm.
And then HAP 2, do we know?
It's just like
Right
another
here.
year. It all kind of goes like another year.
Okay.
Yeah. So HAP 1 is June 30th, 25. HAP 2 is June 30th, 26. Round
And then HAP
3 is split into 2 and it has 2 separate dates apart in 2026.
That's super great.
It is. It's really, it's
Why
frustrating.
would they ever want to be consistent with anything? That's excellent.
Each of
Sorry.
these rounds changed a tiny bit, and so it makes it really difficult.
Thank you.
Okay, you're welcome. Okay. So what do you guys think about using these 3 categories? Do you guys like that idea? And then you can talk about what percentage into the blue, or do you want to look at all of them? I see Sage nodding yes to the blue. You wanted me to make this bigger?
Could you,
Blue's fine.
Veronica, could you just repeat what you'd said previously about the county? and-
Uh-huh.
Go
The
ahead.
county has already allocated funds under the top 2 purple ones and is willing to do all the purple ones. And if the COC is willing to do all the blue ones, the blue ones, or some of the blue ones.
On round 1 and 2?
Yes, rounds 1 and 2. Round 3 is going to
And
have
those
to
are
be
the ones-
different because it's combined.
Yeah. Okay.
So there's 4 purple categories and 3 blue categories. But
Correct.
but the county has less money than the COC, is that right? Is there enough money to
A
cover?
little
the
bit
blue-
less. I mean,
It's
it's,
okay.
it's a little bit less, and the county has spent some of theirs. So that the original allocation was a little bit less, but the county's also already, committed to, they fund most of MCHSCoC, so our outreach team, for the last several years out of it. And they also are committed to funding the Housing Flex Fund, which is available to everybody, but it is a flexible fund for homeless related needs.
And it'll
Can I
include.
ask about a question about shelter diversion and the county fund for that? If you guys are, we had a question come up yesterday at the shelter around, are there any funds for bus ticket? And,
The Housing Flex Fund will still pay for bus tickets, yeah.
okay,
So the Housing Flex Fund would be rapid rehousing, homeless prevention, shelter diversion, any other project types? Probably an SSO with a little bit of care management, maybe.
Yeah, it's messy. We try to make it so
Yeah.
that and Sage, we're actually waiting for some clarification from the state, who's been a little slow on what is allowable within the HAP funding. So I don't know how.
Okay.
We're going to tighten up the parameters and make it really clear really soon. Transportation will always be an option.
would the county be, so for like, say, for the county's allocation of HAP funding for like rapid rehousing, is that going to all be held within the county's
No,
fund, or would it be being considered for contracting out for?
It would be both.
It would
I
be
believe.
both. I mean, you know, it would be both, but I think yeah, it would be both. I don't know how much the county would use of the I don't know that yet. What I think the county will, and you know, the decision makers on this is a little bit unclear, but if the COC is clear on what they're doing, the county can then figure out what the needs are. So it's like somebody's got to make a decision first. Like the
Sure.
county's willing to, and I'll be
So-
super honest, the county feels like they have supported emergency shelters through the funding sources that they have identified for that. And I think it will be better received for the COCs to support the emergency shelters at this time.
And, you know, and an option is to put 93% of these two rounds into emergency shelter. I mean, that's possible. If
Which
that's
is-
what the
yeah, and
COC wants to do.
In the spirit of transparency, I think that there's a case to be made, and I'm going to ask the shelters to, unfortunately, you're just going to kind of have to be a little bit quiet here right now, but I would rather us move to longer term contracts, like an 18-month contract for emergency shelters to get us through, like all the way through June 2024.
Yeah.
So that can be like clear. The shelters know how much money they can expect. They can figure out how to adapt their programs to that. And we can move to some of these more longer term solutions for permanent housing that we need to really spend our time on. So if we are, it's not been helpful to us to constantly be like, okay, as our shelter's gonna have to close, what do we, it's not helpful to the system. So, and I think that our contractors do better with longer term contracts. We certainly do. So I would like to use this opportunity to consider doing that, take care of the shelters first for 18 months. It doesn't mean we can start accessing HAP 3 and probably even HAP 4, next year or whenever. So like those other ones are all active or will be soon. So there's a weird amount of HIP money coming through Medi-Cal managed care, like really strange sort of large allocation coming through there as well. Veronica and I kind of talked this through. There's a lot of different funding sources for families that will be showing up too through bringing families home, the Family Homelessness Challenge grant. So there's still other funding for longer term solutions to homelessness beyond what you're looking at right now.
And those other funding sources have the same type of flexible uses that the HAP funding does?
Yeah, pretty
Okay.
much. I mean, they're
Some more.
in some ways more. We really need to I need to insist that we've got some really good, clean contracting from one funding source from one activity type, because we're losing control of Veronica's time, my time. The whole system is like all chaotic, like we can't keep track of anything and we can't report on anything very well. So we need to really tighten that up. And so that's kind of the goal of try to have one project, one grant, clarity on it as long-term as possible so that organizations can really build themselves and like be certain about it. And also understand what's not possible. We're about to have a hard conversation about non-congregate shelter. And if it's like, that's not going to happen anymore, or it's super limited, we all have to be clear on that so organizations can adapt,
Well, I think that the blue items are good, supported by the COC, just from my previous experience dealing with Dan Jurdy and McCowan the first time we had this conversation. The practicality of delivering permanent housing out of round 1 and round 2 is nil. Like there's not enough time. So,
and Dan, we had always had zeros there because we didn't really understand what they even meant there. It like didn't make sense. So I agree with you on that.
it's just not practical. It would take,
Right.
If you were to start a project today, it would take 3 years before you ever broke ground. We'd never hit the deadlines. Just physically impossible.
That's especially a
that
good point for
leaves-
these 2 rounds that actually are ending pretty soon. Yeah.
That leaves the subsidy reserves and the coordinator landlord incentives, which I don't know how much SAGE has found a need, or the shelters in general have found a need from landlord incentives to move people from the shelter to housing.
I think-
So there might be.
Well, Veronica, did
So I
you mean
wanna-
landlord liaison there?
The service coordination, so landlord incentives have been getting paid out of rapid rehousing funds for rapid rehousing clients through the CDC, and that has been utilized and been really helpful. We haven't had a landlord incentive fund for permanent supportive housing. I don't think, except through like maybe EHV, if the tenant is EHV.
Mhm.
So it could be useful to have landlord incentive funds for that is not attached to rapid rehousing, not attached to permanent supportive housing, not attached to EHV, but is like kind of like the flex fund for landlord incentives. In general, landlords definitely like that carrot.
Mhm.
But I don't think it would be a huge, like if we were to put a percentage in there, I don't think we'd want to put a huge amount
No,
into it, just because it's not,
Right.
it's $1,000 here, $1,000 there, $2,000 over here. Like it's not like 50 grand a month of
Right.
funding
No,
that
I
we
agree.
did
It's
that.
a nice thing to have available. It's important, but it's not a huge
1,000
money.
I don't know.
and the main thing has been having a body at CDC to be able to coordinate who is responsible for that role. And so the primary use of those funds has actually been staffing. And they've been able to use the ESG as a fallback for anyone that doesn't have others. And so instead of going through another agency, they just have it right there that they can pay it, and it cuts out the middleman. And so really it's staffing funding that's really needed to just ensure that there's at least a body there, even if there's not money to back up. I'd like money to back up, but we can figure that out another way if needed.
Can I ask what systems support is?
It's really vague. I don't like this one. I don't even know what it means. Someone to leave it for the county to figure out.
That
System
sounds like
support.
our HMIS and coordinated entry and management.
Yeah, the regional partnership part, I'm just ignoring. They often want that. That's like, I think if people have complicated overlapping counties, which we're just sticking to Mendocino County. But this is a place that Veronica's staff person who spends a lot of time in HMIS can, I think so, right? Veronica, this is where you could.
This is to support those systems, but it's a system expansion. And so HAP round 3, $500,000 is required for use on system support. So I don't think we should actually put any money in system support right now, because we're forced to have $500,000 out of it, out of HAP 3.
Okay.
So I don't think we should fund this.
Is that where, am I right though, that is where a coordinated entry, managing lead coordinated entry
Yeah.
agency would come out of?
Yeah.
That makes more sense, Sage. So it's the coordinated
I
entry
cannot
support.
emphasize the importance of that enough. The significance of having a coordinated entry lead agency to our system,
Yes, but I think that once our cash funding has been exhausted, then we can use HAP 3 because we're kind of forced to. So we should probably not fund that activity type under rounds 1 and 2.
And you think that the cash fund is going to be enough to float it until we can roll out?
Absolutely, 100%.
And we have some spending deadlines on cash, that last bit of cash that we need to spend out anyway.
So with that, given Sage's thoughts on the wrap, because I know from our perspective, we've used the landlord incentive stuff that we received for our emergency housing vouchers to start food banks basically at every site that's got it. So we took the money, instead of just using it as operational cash flow, we bought food and give that out to like residents that doesn't have food. So it's a nice incentive for us. So given that, and that there's 1.3 in here, and it has to be, you said 2025, right? For the deadline for expenditure?
Yes.
That eliminates permanent housing. There's no way anything can be done in there. So if you were to allocate 3% to landlord incentive service coordination, that's about $40,000.
Veronica, you want to click 3% in there? I think your spreadsheet will work.
Hold on just a second. Okay, yes, no, I just needed to reference something. 3% you said?
No, not there.
Zero there.
No. There.
As much as I want money in that hole, it's not going to work.
Is that what you wanted?
And then if you were to put the 90% in the operating subsidies, and this is just for round 1 and 2, we can reallocate.
You know, I might, I
later.
think,
Or do
Veronica,
6%.
remember our landlord liaison contract, which I just want to remind the group was a key piece of our strategic plan, which was a good plan right before the pandemic. And I think we really need to invest in that position for a long, a good chunk of time. When was that position scheduled to end? Do you know, Veronica, funding wise?
9/30/23.
Okay.
But would that be allowed under this HAP contract to fund it for another year?
Yes.
So do we remember, I remember vaguely ranking and scoring that, but I don't remember the exact dollar amounts. I know it was more than $40,000.
It was, but
Closer to 80.
it was, that's why I'm wondering if we want to put a little bit more in there. Again, there's other, HAP 3 is we haven't even looked at yet. So there's other funding sources.
Okay, so if we allocate 10% there and 83% to operating subsidies, what's that?
I mean, I think that's a good amount there. I don't you think, Veronica, the 136, that would give them some, that would give that position some stability for another fiscal year beyond what they've already funded for. Do you think
But I
that
think
would?
we need to make sure we leave money sitting in there for the incentives, because I think that's important.
Yeah,
Have the funding from the shelter side for both McCavan or any of the shelter sides to place those people, because it's an effective tool to get landlords, especially those that aren't in affordable housing.
right.
$2
I'm
grand
pretty
is
sure that the Housing Flex Fund can pay for housing incentives as well. Again, we would be using that for people that it's sort of like if no other landlord incentive is available, it could be there. So if there was a voucher tied incentive, that kind of thing, we would filter out other sources first. But I think that could work. It could work. Veronica, what are your thoughts here? You're muted if you're okay.
I wanted to total up how much we have in shelter requests so far.
Mm.
And I'm missing one.
Now, is this off the original ones with Veronica? We just rated and ranked?
No,
No.
this is off of the ones that I sent out middle of last month on what are your needs for January 1st through June 30th. That one. It wouldn't be that far back. Judy and Michelle, did you guys send me one? We talked about it and I can't remember.
No, we did not.
Okay, that's why I can't find it, because it doesn't exist.
Yeah.
Okay, so far, wait, that can't be right.
So Veronica, can I ask
Yeah.
a question, please? Michelle here in the background.
Yes.
Just because I'm later coming into this, could you or someone just give me the thumbnail sketch of what operating subsidies and reserves includes existing emergency shelter? What specific activities would that fund? And sorry for repeat for everybody else who knows this.
So here are our eligible activities. And so service coordination.
No, she's just asking about the operating subsidies and
Right,
reserves.
Operating
It
subsidies.
basically
So
covers
that's
operating expenses
yes.
for an emergency shelter or emergency shelter activities. I mean, theoretically, it could be operating subsidies for other types of housing as well. Say, for us at RCHDC, we get operating subsidies from the state for our No Place Like Home units. But this isn't a practical program for that, but it's more of a practical program for covering operating expenses for day-to-day operations of shelters.
Mm-hmm.
So
we
water,
have-
sewer, staffing.
Okay, so if we needed additional staffing, if we needed something at our Project Sanctuary's emergency shelter, this could be a source of funds for that?
Yes.
So actually HAP has the same requirements as ESG, and it requires that it be a low barrier.
Okay,
A housing
Shelter.
first kind of concept.
Yes, it has to be housing first. So no testing, things like that. And that's why Project Sanctuary did a non-congregate shelter, because that project is,
Right.
but the emergency shelter itself,
Mhm.
doesn't quite meet the requirements for the state's housing first requirements.
Okay, got it. Thank you.
Which is still very vague.
Very vague, but they're very clear, no testing anytime. Sobriety cannot be a requirement of any kind of, it can't even really be discussed as part of it. I mean, if they want to access services, you can talk about it, but you can't limit services based upon sobriety.
Okay, thank you.
Yep.
That's why that.
So
At some point, we're gonna have to rethink our rules if we want more.
So this is the amount of funding that I have requested as a total from Ford Street, McHaven. Wait, did I get them all? Hold on, I think I might have missed.
Veronica,
one.
though, is that for only 6 months?
Yes,
And
Hold on.
it includes non-congregate shelter. Right?
yes, I missed one. I missed hospitality centers. Oh, but it's still enough. So that's the total request that we've received. And so we would actually have 100,000 wiggle room.
But that's only for 6 months.
Yes.
For 6 months.
Right. So, I mean, I'm going to be clear here. What I was hoping is that we could do 18-month contracts. I was hoping that we could do 18-month contracts. So that there is some stability for our shelters. I think we have to have a hard discussion about non-congregate shelter. Non-congregate shelter is super expensive. And that total that Veronica has in there includes places asking for non-congregate shelter funding.
But that's starting a non-congregated shelter.
No,
It's continuing.
I mean, non-congregate shelter is motel rooms. Let's just call them motel rooms because it's easier to say. McHaven has had some motel rooms. Project Sanctuary has really raced through a lot of motel room costs. I'm not saying that it's not an important intervention. It's just extremely expensive. So
My second question is for the million, how many people are we serving? Was that included in any of those numbers, Veronica?
Yes. Oops. So if we exclude non-congregate shelter, it's that amount for 6 months. And I didn't total up what the numbers were, but it would take me like 10 minutes.
And for Judy's program, since it's domestic violence, it doesn't meet the housing first barrier because is there testing required, Judy and Michelle? Like that breaks that?
No, it's not, we do not test, but the problem with us is all of our shelter is congregate shelter and other people, because we have many times CPS clients, other kinds of clients who are, they cannot be around people who are using or drinking, and we don't have 24-hour staffing at our shelter. That isn't how it's designed.
Okay.
So, because it's all very, trauma-informed based, lots of independent, but so it just doesn't, we just have to redesign our entire program.
Yeah, we're running into some of the same complexities with our No Place Like Home programs, which is housing first and integrating them in with standard affordable housing and how low the barrier is. So we're running into some technical issues on that crossover. I can understand that from a conjugate, especially in a high risk scenario like you guys have. To me, conjugated is important, Veronica, but conjugated, we're getting less bang for our buck. I know Shannon and I have had this conversation before, unless it's not a hotel-based one where there's an actual shelter in place, such as building bridges, that's conjugated. You pay a lot for a hotel. I know, because I've had house people in hotels, and it's insanely stupid even when you get breaks.
So I think that it's been really interesting watching the pandemic experience with non-congregate shelter, because it was promoted during the pandemic. ESG paid for it. FEMA reimbursed the county for it. It was millions and millions of dollars. We have found that the outcomes for those who were housed for a pretty long period of time, it was not a short hotel stay. So for long periods of time, the outcomes were very good, but it was extremely expensive to get somebody there. So, I mean, I haven't totally, like, we have a lot of data from Project Roomkey, which again, the federal government was sponsoring, right? So it was no local cost at all. I mean, it was a huge amount of work, but there was no local cost. The outcomes for people who spent months and months in a motel room were good, but it was very expensive.
And we have families in non-congregate shelter right now who don't have any other options. And so there's that to consider too. It's not an option for them to go to Building Bridges because it's a family with children. So we have to look at those populations too when we look at non-congregate. What are we going to do with those people?
Is 4th Street still doing so I know 4th Street was doing family shelter
Yeah.
and then doing hotel rooms for those that couldn't meet.
Well, there's lack of
variety
availability.
requirement.
Right, there's lack of availability too. So, we just don't have
Sure.
enough beds. We just don't have enough bed space.
And I have this conversation with one of my housing navigators who's like, what about our families that we don't have enough capacity for? And I'm like, yes, of course. What about our single adults that we don't have capacity for? We don't have capacity for a shelter bed for
period.
all of the people living on the street, whether you're a family or an
Mhm.
individual. At some point, we have to kind of just, this is what we have, right?
And we have an extremely
not
low
saying, like,
housing,
Saying this knowing
inventory,
like Megan is
too.
probably shooting darts at me.
I kind of am, but
Gosh, you guys, it's
But I'm just saying, like, in terms of like the number of beds that we have, I think making sure that we have shelter available for families and for adults and for Tay, knowing that it's not going to be enough. It's a Band-Aid
It's
and
not.
that's why we need to prioritize somehow.
Yeah.
But
and the
it's not going to be
period.
enough for any of our populations. We're not going to have enough beds.
Right, and the period of time they spend in shelter is linked to low housing inventory.
Meg, excuse me,
So-
Megan, correct me if I'm wrong, but you spoke about a desire to fund these programs for 18 months and that makes a lot of sense. But based on these requests, there's not enough money
yeah,
to do that.
no, I
So
feel like, yeah, my dream is being crushed. Yeah. Veronica, what's that 412?
That's the balance in the operating subsidies if we were to fund congregate only requests received. So that's the difference between the 718 and the 130.
Right.
But again, that's
there's
only
so many
6
like
months.
factors here to consider too, because so what Veronica asked for is what do you need to keep, we asked, what do you need, right? Is there do we feel like there's an expectation in the community that the COC fills the entire need for a shelter for forever? I mean, I don't know. Do we want to take that on? Is there a sense that
well, and are there other funding sources available?
I think what's hard, what's hard when I put myself in the shoes of a shelter provider, the answer is we always give them is maybe, and that's not really helpful when you're trying to like plan staffing. So it's the answer they keep getting, like maybe. And I hate having to give that answer because I know it's not really that, like, it's kind of like not, it's almost a yes or no is better than a maybe. But the truth is maybe. And I think that's the hard part here. And I don't really have a good solution for that. But, if my dream of an 18-month contract and like we're done with it is dead, that's okay. We'll adjust, we'll move on. I do want to say about families and non-congregate shelter is, again, I feel like there's so many things to unravel after the pandemic, but we really need to right size that. If a family is in a non-congregate shelter, Joanna, that you guys are supporting, and they could be supported through CalWorks or through bringing families home or through some of these other family specific programs, they really should be in that. And we need to get better at making sure that the especially families, because I know what I'm shooting daggers about is not like your thing, but there are there's some somewhat robust funding sources specifically for families. We need to make sure the families are accessing those ones and not more flexible ones. So it does concern me, Joanna, that you've got some families in motel rooms, because I should know who they are, and we should just be verifying that that's the best place for them to support them. Because again, there's other options for families that single adults don't have.
Megan, it's interesting because, we get referrals from CalWorks all the time that says this family is desperately in need. So when you say there's these other funding sources,
Yeah.
we're not aware of them.
No, and they're in the system too.
Yeah, they're signed up for CalWorks. I mean, so
Right.
why would
I
why
know,
would the social worker be referring them to us?
I don't know. Do we need to have, like, I hate to say this, but I'm going to say this.
CalWorks,
Do we need to
CalWorks-
have meetings specific to families?
No, what we need
Short
to do is give
meetings,
me like a
something,
month
or
or
email
two.
streams or
No.
something?
Probably, Joanna, but what we really need is to give me a month or two to launch Front Door for Families. We have a Family Homelessness Challenge grant. I am going to have a single door for families to figure out where they best belong. It's just not quite launched. My new staff member starts
Okay.
on Monday, and it's going to be like one place, because Judy, you and Joanna are totally right. Like there should not be this much chaos around what a family is eligible for. It has to be more streamlined. And so that is a goal. That was a goal in our strategic plan. We're going to pull it off. We just haven't pulled it off yet.
Yeah,
But
and I want
so
to say
Judy,
something else.
if you're being referred a family from CalWorks, like maybe that's a legitimate referral, maybe it's not. I don't totally know. Like I'd have to look at the details of it. Sometimes somebody's over income for CalWorks. CalWorks income limits are super low. So there's different ways somebody might not be supported through CalWorks, but sometimes it might just be an error. And that's the part we have to figure out.
Right.
Well, we work pretty closely with CalWorks for families. We do housing navigation services for CalWorks housing support program. So I do have a little bit of information around their shelter. Their hotel that they can do, and they have very limited funding for that as well. So they're in the same boat as all of us. It's not an unlimited bucket, and so they're having to look at how are they using those funds? How are they prioritizing for the families? How are they accessing other supports and services in the community? And then if they run out of money, they run out of money in it. And so that happens. So I know that they definitely have families that they've had in hotel rooms. But for the last couple of months, I think they've been out of funding for hotel rooms.
Yeah, they have been. And Fort Streets is only like, I think they do up to 3 nights to try to get them connected to somewhere else, but it's just a Band-Aid as well. It's not long
So
term.
the question that we still can talk about is if we want to allocate some funds for non-congregate shelter for, I would advocate a very narrow population that when there's no other suitable way to keep them off the streets. Like that is a use of non-congregate. I mean, that's a way that this group could decide to use non-congregate shelter, understanding it's extremely expensive. And but morally there's reasons you wouldn't want, I mean, I don't know, it's up to this group how they want to do that.
I don't know. There's another piece that I look at and consider when we place people in motels, and that is that are we keeping them out of the ER? Are we keeping them out of the jail system? Are we preventing other things from happening or occurring in our community while we have a stopgap and we have a place where they have a roof over their head? There's just a lot to think of. And the other piece that I think of too is, as an employer, is many of the staff that work in this type of work were formerly homeless themselves, and they live paycheck to paycheck. And if they're working in a job arena where their jobs aren't secure and they're living paycheck to paycheck, then they're at risk of homelessness again, with children and a family. And so there's a lot to look at in terms of what we're doing in our community until we have better answers or more funding. But right now we're at a place where there's a lot of homeless in our community that are impacted, and for different reasons.
When does HAP round 3 come into play?
Veronica,
Yeah, I noticed. It's available anytime. We've received the disbursement for the initial amount for the $500,000, and I just put the full packet on Becky's desk for final signature for disbursement for the remaining balance of 1.7 million.
So it's a little more than this amount.
Here,
I
I'll show
was
you.
just, so if we, I was just thinking if we used this as a bridge for 6 months, even the inclusion of
so-
round 3 only gets us another 6 to
Yeah.
12 months. If,
I'm gonna
if
tell
we
you
were to
if-
allocate the funding this way.
If we were to tell the state that we're using all of our HAP money for emergency shelter, it's not a long-term, it's not a good idea. I mean, we
So-
have to
It's a
find a
global-
way to get people out of shelters and housed.
The NOFA for perhaps 3 and 4 actually changed the requirements regarding emergency shelter. And there they have a lot more requirements. You're required to use evidence-based practices, and there's a lot of documentation that has to be provided to the state. And so that's why we can do this for rounds 1 and 2. But I don't know if that's going to be possible under rounds 3 and 4. I don't know.
We could use more money. Oh, yeah.
So do we agree with the percentage here? These? Do we agree on that?
Sure.
And this is a recommendation to the full COC that'll go up next week.
Given the timeline for expenditure and the current needs, I don't personally see a lot of other options here.
I don't either. I mean, we have to support the institutions that are providing like the most basic.
We
know.
could also do the landlord piece out of HAP 3 and
We
zero
could.
this out and make this 93 and just do solely shelter.
Oh,
What do you guys think of
That's
that?
true, Veronica. I mean, given that, so I guess I'm also thinking, so not that I think we should make decisions based on what the state's perception of our work is, but if it looks like the COC is putting 100% of their funding into emergency shelter, is there any problem with that we're going to struggle with?
But wouldn't we be able to demonstrate to them how the county and COC have collaborated to expend the full HAP round?
Yeah,
And
I
split them
think
between
so.
the different categories. So it's not that we're saying we're putting it all into shelter. We're saying we're splitting, we're collaborating and coordinating strategically with the county and COC so that we can, cover our bases.
Yeah, no, and you're right, Sage. That would be a better way for me to explain it. That's how we would explain it. But I think, yeah.
and I
Yeah,
think
we
it
could do
also
that. I mean, it's
presents
certainly
a realistic picture of what's going on in our county.
Well, I think that we're saying the philosophy is we need to fund the core shelter stuff first so that we can dedicate time to other things that are not necessarily like day-to-day shelter, but super critical to rebuilding a housing system.
Right.
That
I think
makes sense.
that's very plausible. I really do, because you have to present what is the reality, what is the urgent critical need within our communities and counties, and what are we doing to address the need and build forward from it.
So Veronica, if you make that a 0 and a 93, what does it look like? So it could, if we did the congregate shelters only, and that's if we just did exactly what they requested, we didn't really like look at it more closely. So that, let's assume that's not exactly, we could potentially get a year contract for the congregate shelters out of this. Calendar year 2023. Not my dream, but.
And not meeting their entire request, right?
Right. I mean, Veronica, it was a crude request. We haven't looked at it very closely, right? And
Okay.
so
Right, it's a
I
request.
mean,
of
I literally haven't
multiple
looked at it at
agencies.
all.
No, I have, and they're existing projects that would be continued. We wouldn't be creating anything new.
No.
So that would be the question for that would be, if we stuck with this and we put 1.2 million into emergency shelter, basically, it would be leaving no money for operating subsidies for any other kind of housing project, at least from this allocation, but there's other money around. And we would need this group to decide what proportion of that you want to go to non-congregate shelter versus congregate shelter.
So 2 of the 3 could be funded out of this for a year, a full 12 months. It's the 3rd contractor I'm concerned about.
You mean
Yeah, I'm looking at the requests, and if I double the request, it's like, well, 2 of them. Yeah.
2 of them could get a full year, but
Yeah.
or all of them could get 3/4 of a year. So let's like
Right.
not look at it quite that. I think the question for
Yeah.
the group now is what percentage, if we went with this concept, what percentage of the 1.2 million would you want devoted to congregate shelter versus non-congregate shelter?
For me, I think it depends on
And the
how
five
much
what's left. We do the math.
funding is already, how much, like, okay, so knowing that we're doing non-congregate shelter for families, what does Ford Street have for doing non-congregate shelter for families? In term, and
I think they would be okay not providing that. I think Ford Street would be okay with that. It's an extra thing that they do for folks that are in crisis that show up. And I know that Hospitality Center, they kind of have other sources for it, so it would deplete their budget, but it wouldn't kill the project. But I know McCavin's project, it's solely non-congregate shelter.
And Project Sanctuary has not requested any non-congregate shelter money,
Well,
correct?
Not yet.
Well, that's because with the 6-month timeline and what we already have with the ESG, we thought we probably, if it was extended for a year or something like that. I mean, because we really, in our regular standard budgets, do not have money to give people for motels.
Right.
And
Right.
and so, and we do like to, I just want to say how much I agree 100% is in some ways. It just, the non-congregate housing and the cost of motels just seems absurd. It'd be so nice to use it in a different way than that.
Yeah.
But that's what's available. That's what it's delegated for.
I agree with you, Judy. I have such mixed feelings about it. I mean, and having really been pretty intimately involved in a complicated motel room project for 2 years, there is such value of having your own private space.
Yes.
There's such value in being able to like stop and end it. Like, okay, this is over. Like the infrastructure provided by the hotels is also huge, right? Like they are the ones who are responsible for the room. I mean, it's like a huge, help there. And it's so flexible in that way.
It makes me wonder too, if those of us who provide non-congregate shelter could approach the motels that we use consistently and let them know that we have funding for this period of time based on our data. This is what we ran through your business for this period of time, and negotiate on a fee.
And I think you might have some luck with that. You may or may not. I mean, I know like the coast, there was a hotel
because
there
it's guaranteed use space.
Yeah.
Their rooms are used.
They kind of, what our experience was like during the slow season, they're much more open to that than during, which is kind of, winter is important. But I'm wondering if this group or the COC needs more of a kind of clear philosophy on non-congregate shelter and then work from that. Like, is it it's a brand new activity to the homelessness world. Like no one was really doing motel rooms in a consistent way before the pandemic.
It's a bridge. I consider it a bridge to housing. When we have low housing inventory and we don't have a lot of options, it's a bridge.
It's interesting, Joanna, though. It's interesting in how you use it. So the city of Fort Bragg has an emergency winter shelter that they run through a motel program. Their housing outcomes are 0%. Not a single person moved on to a better permanent housing situation from that. So,
and is that because of their housing inventory too?
They chose to run a shelter through a motel room system. It was a good choice for them. I'm not knocking it, right? Like it's the way they decided to do it. They had good participation from the police. It kept people off the streets. It kept their tourism industry. Like that was important to them. Like it met those goals. It didn't get people housed.
Okay.
This is Michelle.
They don't combine it with a housing targeted case management. They don't combine it and it's like, it's kind of, I don't think it's even guaranteed night to night. So the people that are left wonder, like they don't have the security of knowing I
Right.
have shelter tonight to
Right.
know like I can focus on something else. And so it's very much set up to be a emergency weather shelter and not a like housing focused navigation center type project, like
Yeah, I look at
I
more
think-
stabilization, stabilization to move forward
Well,
and not return to the street.
Yeah, can I add that this is Michelle from Project Sanctuary, because
Okay.
we serve the entire county. And also I'm a coast person, I commute back and forth. It's been a godsend for us to have the motels for the coast Project Sanctuary folks, because we have no other emergency shelter there. But we're one of the agencies, we've had people in there for months and months and months. We did have really good outcomes, but you're right, we spent a fortune, so we do struggle with that. But it's been a godsend for our clients on the coast to have something available. And we had
Right.
some success with some motels getting better fixed rates. Other motels charge us outrageous amounts of money. So it's a really expensive program. The emergency winter shelter program that City of Fort Bragg is running, it's a very different model. People have to present themselves every day they're not guaranteed anything more than one night. They get no case management. They get no follow-up. They get a place to sleep at night, and then they have
That's
to
it.
leave, and then they have to reapply. So it's a very different situation there. So for us, yeah, I mean, the HMIS funds, the emergency shelter, non-congregate emergency shelter has really been a huge benefit for us on the coast because we have no other options. Again, but we're trying to fit it into what we can do with this money. We could have spent that money and rented a lovely big place and had emergency shelter, but that's not a permitted use.
Yeah.
So, we're trying to make it work too for our clients.
Right.
I agree. I think there is a place for the non-congregate. Do I think it's the best way to spend all the money? And no, I mean, you're right. Well, I agree. Everybody here agrees. What we need is more affordable housing. We need more housing units built. We need more housing built units converted, perhaps, into housing. We were very successful with the clients that we kept, but we're talking 7-8 months. We had people that got EHV vouchers and then lost them because there's like zero vacancy and landlords on the coast don't want to rent, kind of thing. So
And Michelle, we had
That's why I
similar
like that
outcomes.
incentive though.
We had similar-
I
agree.
want to look more into that landlord incentive piece.
And Michelle, just to echo, we had similar outcomes for room key for people who stayed
Right.
months and months and months. It was
Right.
not a short intervention. I still think, it was worthwhile, especially when we were spending the federal government's money,
Right.
which I guess you guys were too. Sure, we'll do it.
God, I
No
wish there
problem.
was,
But it was effective, but it was expensive and it took a long time.
Yeah.
But that might
I
be
wish
what,
there was more
to
of
do.
that though, because when they can stay in one place, then the parents are more able to gain employment. The kids stay in school, they're more stable with their homework. I look at families, okay, but even single individuals, if they have a place to stay, a stable place to stay, then they can have other stabilization steps in their lives, whether that's medical, behavioral health, or a job. But if they're
if they
bouncing
have
all the time,
constant case management.
right, they have to have the case management. It's absolutely key. Absolutely. But that's what stabilizes them and then reduces our numbers on the street. So
Sage just had
we
her.
don't have any answers today. We don't have any answers to remedy this today. We can only keep working forward.
We don't have the answers to the big problems, but Veronica and I need to start working on contracts. So we have to.
Right.
Have
Right. So the question up for grabs is how much non-congregate and congregate?
I
Yeah,
have no
Sage
idea.
has her hand up, their hand up.
Thank you. Yeah, I think these are really hard decisions to make around how do you prioritize like non-congregate, congregate shelter, like looking at the fiscal model of any project of I look at the what is the cost per bed or the the cost per bed per night
Right.
are we getting our bang for our buck? What is the model that each of the shelters are providing? Is it shelter only or is there a housing focused? And what are their housing outcomes that they've had? I know when we apply to ESG, the regular ESG, we have to provide what is our cost per exit to permanent housing? And that calculation is based on what is the entire annual cost of the shelter divided by the number of permanent exits to permanent housing. And they look at that for looking, how housing focused is the project and what's their outcomes. COVID did a thing for us, which is it gave us a lot of money to spend for a short period of time, which 3 years for COVID, like the COVID funding that we got, it actually, yeah, I mean, we got used to it in some ways, to like in 3 years, we had this amount of funding to do way more non-congregate shelter than we ever have. I mean, before COVID, we didn't have non-congregate shelter really. We had a tiny little pot of money at the winter shelter to do hotels for families, but it was like a week at a time for like 5 families over the course of 6 months. Like it was very small. We didn't have non-congregate shelters. So COVID gave us the capacity to add that in. But now we're back to this. We have way more money now than we did before COVID, like HAP is like, but because, well, there was some reallocation of funds of like the state portion of ESG got reallocated out of VSG and into other sources. So we do have more money than we did before COVID, but it's less than we've had for the last 3 years. So we have to make some really hard decisions around how do we support the projects in our community? And that's going to mean scaling back on what we're supporting. And I just am thinking back to like the struggles of like not even having funds for a winter shelter and for and yeah, I don't know. I am.
So, Sage, can you
We can all advocate really hard for like the model that we're doing, I think. And I'm like, I think non-congregate shelter for families is the way to go. For individual adults, I think congregate it's not fiscally responsible, I think, to do non-congregate for individual adults, but
I tend to agree with Sage. I mean, there may be some very narrow, very specific exceptions. Somebody's super physically frail or something like that. Like some ways that there's a community impact that Joanna's mentioned, keeping somebody out of the hospital, things like that. But
and I would
those
look at,
parameters
I think
probably
we
need
should
to
be
be
really
super
talking
clarified.
about, I think we really should be looking at the CalAIM and ECM resources for some of that too, and really leveraging these other funding streams that are coming through to support those really like that's what I'm looking at right now is our how do we use CalAIM community support fund to support those really frail medically fragile adults.
That's a good point.
Yeah, I'm really worried about our congregate shelter. And in terms of having a low barrier shelter and how do we, if we do non-congregate shelter, it takes up a lot of the money that we have for shelter. And I think it would be really important to look at the number of beds and the housing outcomes and the number of people that we're serving and what are our goals.
I think this is maybe a bigger conversation than we can resolve at today's meeting, but it's an important one. I do have a question, I think, for Dan, who mentioned that they might apply for operating subsidies and things. So what I'm hearing is that we have existing requests related to emergency shelters. Do any of those existing requests include operating subsidies? And if not, maybe Dan could explain what those needs look like, at least for RCHDC. I don't know what other organizations might also have operating subsidy needs.
We wouldn't trump, Shannon, we wouldn't trump shelter request for operating subsidies. I would pull operating subsidies from someplace else if we needed that. It's more for our no place like home units or our units that we're converting to housing first model that we're finding we need operating subsidies on. But I'm not going to prioritize that personally at RCHDC. over the need for emergency shelters or conjugated shelters. So
Thank you for that clarification.
not out of the HF funding. I mean, it's not, the bang for the buck is not there.
Got it. Thank you.
What
Did
if
they answer
we
question
made-
originally with the split? I think the split should either be 85-15 or 80-20 from conjugate to emergency shelter, non-conjugate shelters.
I appreciate some sort of clarity like that, Dan, because we have to do this. And I think if there's a value in some certainty to these housing providers, because if they know what they're getting, they can figure out how to work around it or how to change their programs. And if we can't give them some certainty, they can't adjust their projects to what is realistic. So we're doing them a favor, even if it's less money than they had hoped for. There's a small favor in there, at least if it's some clarity.
I think it should be 80-20 or 85-15. That would be my feeling. I understand the importance of conjugate shelters, but I also, having rated and ranked many of these, I've seen, the bang on the buck on the backside is not nearly as much as we're getting out of the regular emergency shelters. And I also am concerned if we just continue subsidy for shelters with no advent for permanent housing or something like that. The state already wanted to pull back the round 3 funding because we weren't aggressive enough. There has to be some exit pattern for fixing the housing stock or convincing people to open their housing stock up for this clientele.
Okay, so Veronica, it looks like what you did there was, so you put 85% of it into congregate and 15% into non-congregate. And
The
what
other
we-
way around.
Pardon?
The other way around.
Oh, sorry, 85 into congregate, 15 into non-congregate. And what we could do is do year-long contracts. It'll, on something proportional that'll make sense with that total amount of dollars. So $1 million in year-long contracts to our congregate shelters and 1 year-long contracts for non-congregate shelter.
Would we, just looking ahead, because, it's very uncomfortable to just plan a year at a time.
Yeah, I know.
But looking ahead, would we then be looking at HAP 3 for then 2024?
If it's available, Sage, because I don't know if, and I'll just use RCS for example. I don't know if RCS is going to want to deal with the paperwork and the front loader requirements for the HAP 3 funding, because I know Veronica and I talked about this before. It's not as open as this one was. This one was like pretty much no rules, and HAP 3 and HAP 4 got a lot more rules appended to the emergency shelter side. So, that would be at the.
I think we're gonna have to, or lose our emergency shelter.
Well, I know.
I
I'm
don't
just
know.
saying there might be some not practical stuff that doesn't make it work, right? I don't know that for sure because I haven't seen the final wording, but I know we found that on some things. It's like when they switched it, it's like it's not even worth dealing with it. But I think you guys can work around it. That's just a thought.
So
I
say,
mean, I'm not gonna lie, like, if we can't doing a low barrier shelter navigation center that is, we either have to figure out if this is the funding that's available for that, because there aren't other major sources of funding for emergency shelter. There aren't.
Yeah.
There's small buckets, competitive funds for ESG, but it's a small bucket of competitive funds that we get sometimes and we don't get sometimes, and it really is depending. So
Sage, are you like 90% dependent on this money for funding the emergency shelter?
To operate it at the level that it is, that to keep it year round and have 55 beds and be open to the public for public services as well, to be able to provide day services to folks and be a housing navigation center. The yes, the bulk of the funding would be coming from this. There is very, very little funding coming to this facility outside. Like, we get a tiny little bit of money from general assistance, which is great, but it is not even enough to, I mean, like, we're talking back to winter shelter open only at night, not having a navigation center.
Can I ask that so this conversation that we're having is really critical, and it needs to happen with a larger group of people. And we need to also find a format for the people that are not doing the services to be able to advocate for what their position is, and then have the conversation without their participation, because this is a tricky conversation to have. But this is the kind of like, I don't think I'm supposed to say this phrase, but maybe this is the come to Jesus conversation I thought we were going to have a couple of years ago, and it got delayed by the pandemic. But it's really where we were. Like how, where are we going to prioritize our time and our efforts and our money for the best bang for our buck, understanding that we don't have an unlimited pool. We had this weird unlimited pool for 2 years, right? So it was super odd, but we're back to reality here. We know what is on the table. We have better data on what our outcomes are. And I'm thinking, looking to you, Shannon and Dan, that this conversation has to happen. It has to happen soon, or we're going to be just in this kind of loop forever. You know, like where, and it's not helpful to, we got to get out of it somehow.
I agree.
But what I appreciate now is, if we're settling on this or getting close to settling on it, Veronica needs some direction on what kind of contracts to draft so that Sage and the Coast and Joanna have some clarity so they can make some decisions. Like they need that, and we have to do that.
Well, I think they should be year-long contracts that gives them that time to spend it over whatever the time frame that they have. Whether, I mean, I know it's probably not going to cover all their needs, but if it doesn't, then they at least know they have an expenditure time of 1 year.
I think what we need to do, the rest of us need to commit to, Dan, is having this longer conversation, whatever venue we have it, so that we can have some clarity for them beyond 1 year. Because Sage is totally, it's really fair question to say, can I count on HAP 3? Can I not count on HAP 3? And once again, we're kind of like, I don't know, maybe. And it's not, we need to be able to give more clarity to our people on that. And probably the time is within the next 6 months, we need to be able to give some clarity.
I understand that, but we also
It's
also
not
have
just-
to make sure we're stopping it, the housing problem from the state level too. I mean,
Yes,
if we're just throwing stuff
absolutely.
at shelters, that's not going to go over.
We can't sit with that. We cannot put all of our HAP money into shelters. We just can't do it. We have to like invest in other areas as well.
Not.
Because did you ask why not, Sage?
We're not putting all of our HAP money into shelter.
We're putting all of the COCs round 1 and 2 into shelter. That's okay. That's good. But we're noticing that it's only buying us 9 months. So like, that's not great, like in a big picture situation. So we have to look at all of the funding sources together and make sure that we're supporting the whole system. I think this is the right thing to do today, for sure. I'm totally on board with this. But we have to leave room for the longer conversation with a broader group of people to really lead this whole conversation. Because if it's not you guys who lead it, it's not going to be led.
So I think it's really helpful to know so this thing happened in COVID where we had the ESG CV funds, and then we also had HAP funds, and we did this RFQ thing. And the understanding that I had, and maybe I was incorrect, was that RFQ was going to be the ESG, that we were going to be rolling out the ESG funding and HAP funding for that. And so we only needed to plan on the ESG CV funding lasting for a certain amount of, like, it would cover until we could get HAP rolled out. And so we had a contract to go through September of 2023, but we knew we had budgeted and planned to use the funds before that, thinking that HAP was going to roll out. Taken longer for that to happen. But so in terms of like this future looking forward, how we structure our funding and how we spend it depends on what we know is going to come up, whether that's a year from now or 6 months from now or 9 months from now. What's the next thing coming? And so that's really helpful for us to know, I think, in terms of like, when would HAP 3 be rolling out? Would it be a year from now? And whether it's going to, and yeah, that piece around just being able to plan for how we're expending our funds is really helpful, and we get
I would-
really stuck when
I
we
would
don't have a
think that
clear
it would,
understanding of that.
top three would go in July or August to meet the deadlines, because I mean, that would get us past this fiscal year.
Right, and I guess if we follow our process, which we talked about in the very beginning, if we issue an RFQ now too, that would be presumably HAP 3 funds that we would be talking about sort of beginning July 1, right? So there would be this sort of 6-month process of planning, and really we should do HAP 3 and 4 at the same time, Veronica, I'm thinking, right? We really should. So there
We
would
don't know
be-
how much 4 is yet, though.
We don't know how much 4 is yet. So we would use that RFP, we'll probably do a P, to have some clarity for all of our activities moving forward. I'm not doing any more 6-month contracts. They're too short. Basically, Veronica does the contract and then it's like all over. Like I want to do a year, even if it's just not enough room to really operate.
So at this point, do we need a motion to accept this expenditure plan?
So this will need to go to the board for approval, but we.
So a
we should
motion for a
definitely-
recommendation?
Yes. So the motion would be to budget 93% of HAP round 1 and 2 under operating subsidies and reserves, and to divide that amount 85-15 between congregate and non-congregate sheltering.
I so move.
I second.
All right. When I call your name, please say yes, no, or abstain. Hold on, I am not prepared for this. Okay. Dan,
Yes.
Joanna,
Abstain.
Judy, or Michelle,
Approve.
Shannon,
Yes.
Sage,
Thing.
and Wind.
Yes, approve.
Motion approved. So I will put together a presentation for the board. Do you want that recommendation to also include what it would look like by agency if we were to honor current requests? And if we were to like apply the 85-15? So I was thinking like,
Veronica, I think it's gonna
No.
need a little more time before Monday's meeting to do that, and I don't know.
oh,
I mean, aren't we meeting on Monday?
yeah, I can put this together. It's no problem. It would be
But I
pretty-
don't know if you want to break it down by agency yet, because
Okay. Okay. We
Yeah, I
should
just-
probably get that as a separate process.
Yeah,
And so we would be presenting what this here is, the 93% and then the 85-15. That's what we're presenting on Monday?
I mean, I'm just trying to think through out loud, because you also need to start getting contracts ready. So I guess the question is, do you need direction from the COC to proceed with the contracts? And if you do, they probably need to know the dollar amount. Is that where you're heading, Veronica?
Yeah. And
But
so
do
what I
those
was
contracts have to
thinking
go
is-
through a rating and ranking thing, Veronica, and is that excluded?
They
from
already
this?
kind of did.
They all are qualified through the past RFQ, the one that's still active.
And they all went through rating and ranking already. And so this is just really extending an activity already approved with additional funding. And so we could do the rating and ranking.
No, if we don't have to, then.
No,
you
we
should-
don't have to. So what I was thinking is like we have this amount in requests. And so figure out like, let's say one is 250,000. Well, that would be 25% of this. And then apply that, and then break it down between congregate and non-congregate. So maybe they requested 250 in congregate. Well, what is that when applied to the full request, and apply that percentage to this one? And then, so it would be more than what's requested.
So you
but it
do a
would be
complicated
clear.
proportional thing.
Yes. And it'll be very clear, like what it is.
Does every request include both congregate and non-congregate?
No, we have one request that is only for non-congregate, and we have two requests that do not include, that are congregate only.
Wow.
Right?
Okay, good luck with that.
Yes. No, I got this. I got this.
Well, I mean, I guess I hadn't quite put that together. I think we're going to struggle, and I don't know where to have this conversation with the non-congregate shelter only. If we have only one provider providing non-congregate shelter for $190,000, does the COC feel like they should have some say in the parameter of the use of that non-congregate shelter? Like how, what populations are served, that kind of thing? Because we haven't really done that in the past. We've left it up to providers, because again, we were spending other people's money.
And that could be specified in the contracts. So we could do that on Monday and determine, what populations should be prioritized for non-congregate.
Well, I'm feeling a little bit confused because we might apply for some non-congregate shelter money if we knew that it was going to be extended for a year.
Yeah.
We didn't think we could possibly spend it, and we didn't want to just abuse that process, so we didn't apply. But now, if it's got a longer extension date, we might apply for it.
Well,
In some ways, I'm thinking the non-congregate shelter contract should only be for 6 months to give some like more room for clarity about how we feel about non-congregate shelter. And
how much of this 190 do I do for it? Do I do the full amount for 6 months? Do I do half of it? Well, and I can't do 6-month contracts.
No, I know. I know. But the chances are that provider would run out in 6 months anyway, I guess, right?
Yeah, it's going to be.
Depending on how they arrange themselves, but yeah.
We can't really fund any of it.
It also depends on need. So I do believe that there should be eligibility requirements for shelter and for non-congregate shelter. And we have to look at it with an equitable lens to the homeless population. And so I'm all for that, looking at eligibility.
Sage?
I'm a fan of looking at like prioritizing a population for a non-congregate shelter, and since we have limited funds for it, and really specifically prioritizing families with kids for non-congregate shelter, and also wanting to make sure that is inland and coastal. So if there is one agency that is getting those funds, that they are able to serve somehow across the county. I'd also, in terms of congregate shelter as well, I think it would be good to look at how do we, I'm just gonna jump out on a limb here and say that the two entities that applied, one is a coastal shelter and one is an inland shelter. And so how are we dividing the money between coast and shelter based on any number of factors, like percentage of our homeless population based on a pit count, that sort of thing, that and also like how many beds are we supporting on the coast and inland, and like a cost per bed per night, and so that because it might be, well, we might have, the COC might need to make some decisions around reducing the amount that they're awarded. Like the agencies requested a certain amount, and we may need to consider the COC actually saying, okay, you asked for this, but we can only offer you this. And
that's kind of what so I did an example here of what I was thinking.
And I realized as one of the applicants, I can't actually really be involved in that end conversation. So I just am throwing it out there as kind of like a food for thought.
So the only requests that we actually receive for coastal specific services is Hospitality Center. And they only requested congregate funds. They requested 0 non-congregate. And so they requested $40,150 for a 6-month period. So if we apply that to the overall total that was requested for congregate, it's 5.59%. So if we take that 5% and apply it to what the COC is budgeted, it's a $60,000 contract total for a 12-month period.
I'm confused. Or I thought you said that there were 2 entities that applied for congregate. And if we have
3.
718,000 in congregate shelter asked,
Mhm.
3, Ford Street also applied for congregate shelter, Veronica?
Yes, they applied for
so
both.
there must be 3 entities that applied because we didn't ask for $660. Yeah,
So when I took out Project Sanctuary, we
Okay.
made it simpler.
I was when I heard you say 2, I was thinking that the inland shelter had asked for I think we asked for 400 something, 400 and something for the 6-month period. So I was thinking that
Yes.
remaining 300,000 was the coastal shelter, which just proportionately was off in
No,
my head.
that's also
But
Ford.
it's not- so there was a third.
271.
I think Shannon and Dan, we have to figure out how to have this conversation with the right people. I mean, I'm getting increasingly uncomfortable with.
Just we're gonna have to have another rating and ranking before we can
Okay.
bring this to the
I
COC.
think we're gonna have to too. We're gonna have to have a, so let me, I'm thinking out loud here. I think if the COC can approve conceptually the allocation of these funds, and then we could have a very quick, non-conflicted ad hoc committee review the proposals, then Veronica can have direction to do the contracts without having to come back. Will that work for you guys? Do you think, Dan?
Yeah, I think that'll work for the board.
Because we're going to need to be clear on why one entity is requesting $40,000 for 6 months and another entity is requesting $400,000. And I think we can do that, but we need to be able to be clear on that.
Megan, are you thinking that at Monday's meeting, there will be a discussion regarding the prioritization of non-congregate housing?
Yeah, what do you think there needs to
I
be
think
there?
it should be a
Probably.
separate item.
No, it should be a separate item for sure. Is that the right venue for that conversation? I mean, maybe we just need to get some stuff done. Just
We'll
finish.
start it.
It could be a long conversation, or it could be the start of a conversation and then an ad hoc or something could be assigned. I don't want to hold up these contracts in any way, but I do feel like there's going to be a lot of interested parties there.
Well, I think if we have the clarity that we have today, there's $1 million for congregate only and $190 for non-congregate shelter. And then we have a quick ad hoc to review the congregate shelter requests. We can kind of move forward with allocating that $1 million over the next calendar year. And the non-congregate shelter is a separate conversation in terms of eligibility. You're right, Shannon, that I guess we could begin at the COC. We might as well. We may not be able to end it. It would be great if we could end it too, but we could at least begin it. Does that make sense, Veronica and Dan and everybody else? Because really what we're talking about is a new kind of housing activity and really understanding getting some clarity around it, which we just hadn't really done yet. And Sage is right. In the past, it's been very limited to families with children and it's been super limited. And maybe that we want to stick with that. I don't know. We want to go back to that, I guess we could say. That's a conversation I think the broader community has to have.
Well, and the realization that we may not have the kind of funding for that type of housing like we have during the pandemic.
We certainly don't, right? So we're going to have to narrow it somehow. And how do we do it?
I also think it's helpful for all the staff who are involved to have very clear parameters because it's hard to say no.
I totally
And
agree,
so-
Wendy. And it's confusing to the people on the street. I get people
It
call me all the
is.
time, how come they got a hotel room and how come they didn't? It seems so
Right.
random. And I'm like, you're kind of right. It was random. It's not great for the system to have it be that random.
It's not. And I just have a quick question too. Veronica, is the ranking that we did in the beginning of 2021, is that the ranking that is still in place?
Correct.
Okay.
Okay, well, I have what I need to do a presentation for Monday. And I'm kind of thinking we might want to suggest that the board establish like either an ad hoc or identify a committee to make a recommendation on non-congregate shelter
It's gonna have
prioritization.
to be an ad hoc because the committees have too many service providers on them, so it's gonna have to be an ad hoc made up of the people that aren't applying.
Okay,
As much as I would love to say it could just be strategic planning, but it seems that the most active members are also the service providers, so.
Mhm.
okay. An ad
Well,
hoc it
and
is?
by definition, an ad hoc is for a limited scope and purpose, and that's really what this is.
Okay,
Anything else we need to cover on HAP?
I put in a plug for as much as possible expediting. Just
We will.
trying to prevent, expediting as much as possible.
We will.
If we could know on contracts and what things might look like by like, I have to start making some really hard decisions. If we can't get clarity on where future funding, not future funding starting January 1st, I have to start making some really hard decisions.
I mean, I think the ad hoc committee should try to meet like within a week and a half or so of the COC meeting.
When it seems like the congregate housing discussion is a fairly simple and straightforward one.
I
It's
agree.
the non-congregate housing that might be a little more extended. So I think there's the possibility that we could prioritize those contracts for congregate housing.
Right.
Is that, yeah, okay.
and then do separate ones for non-congregate. Once we
Mhm.
have that identified, we could do that.
And on
Yeah.
the non-congregate, what we're really spending time on is the eligibility and kind of expectations.
Prioritization, exactly, yeah. Do we need to go back to the discussion about the RFP or RFQ process today?
That's up to the committee.
I think we should issue a new RFP.
I think so too.
Veronica, for 3 and 4, so that Judy and all these other places that if we're given parameters that we're gonna be doing year contracts for expenditures, not based on year of funding, but we're gonna do year contracts, and if we can't fund it, it's gonna be funded proportionally. That way everybody understands what that is for 3 and 4.
And before you joined, Dan, Megan indicated that there may be some new service providers interested in applying as well. And because of the timing of that original RFP, scope of services might have been pretty significantly different than they are now.
Well, and the other thing that we've also have to deal with is the contracting process with the county has changed significantly since the county exploded Department of Health and Human Services.
There's
One
another
other-
population we haven't discussed in terms of non-congregate, and that is those people with serious medical issues where the shelter is not an option for them. So let's not forget them in terms of eligibility.
So
One
that'll be
other
part of the ad
thing-
hoc discussion.
Just real quick, another thing with.
Sorry,
HAP
I just want to clarify something. We have a shelter full of people with serious medical issues.
Right.
I
But there's
just wanna
not enough
clarify.
beds
We have a
there.
congregate.
either.
We have
Yeah.
a congregate shelter full
Right,
of
but there,
people with
yeah, but when there aren't
many
beds
people with serious
available
medical
there,
issues.
yeah, when there's not beds available there, we have to meet them elsewhere.
So HAP 3 tribal allocations have been announced as well. And so we need to also do some cross-jurisdictional coordination with Sherwood Valley Band of Pomo Indians, Caddo Band of Pomo Indians, I think is the official name, and who I think it was Manchester Bay, but it might have been different. So there's 3 tribes that have received HAP 3. And so those are additional funds that could be available specifically for tribes and tribal through tribes.
that were awarded?
Yes. Yeah, if you go
Yes.
to the HAP website, it's on there. Sorry.
Yeah, and if you want a really interesting mess, just look at Lake News for Lake County's HAP award.
That was such a mess, Dan. I couldn't even follow that article that you sent. Like, I know
It's still a mess.
it's unclear to me what was going on there.
It's still a mess. Well, basically what had happened was there was a lot of commitments made in a HAP contract without actually talking to any of the subservice providers. It'd be like me committing McCavan, Manzanita, the education office to a whole bunch of commitments on an application without even talking to them about it.
Mm. Always not a good idea.
No.
So Veronica, do we need a motion for a recommendation to develop a new RFP for HAP rounds 3 and 4?
We can, if the committee would like, or we can just make it part of the presentation and a board discussion. In that,
Just make
with
it part of the presentation
yeah.
as a separate item.
Is there anyone who objects to developing a new RFP, RFQ? All right, it looks like we have consensus there. I think that concludes the agenda. Veronica, do you have anything else that we need to cover?
Not at this time.
I appreciate this group. It's really helpful. There's this, we're again, I'm just gonna forewarn us. We've got like the rubber meets the road now in this upcoming year. Our I don't know, doesn't really feel like a holiday, but our pandemic holiday is over. And we've got to like really like pick up and make some hard decisions. So it's really important for Veronica and I to get some clarity from the community so we can actually do the work to get the stuff out done. So even if it's hard decisions, it's so important for us.
So I put a link to the Tribal HAP Award page in the chat.
All right, thank you, Veronica and Megan, for all your work on this. Thank you, everyone, for your time today. Happy New Year.